Please.
Good afternoon. We'll see how I do. I practiced it today. So thank you, Senators, for the opportunity to come before you today and share a solution to the opioid epidemic that saves lives, and importantly, that we are already doing here in the Hudson Valley. My name is Annette Kahrs. I am the founder and president of the Tri-County Community Partnership, a drug-free community coalition. Our primary focus has been on youth prevention education. While that remains the central focus of our efforts, in 2018, our coalition decided to address a more immediate need in our community by bringing a highly successful deflection and pre-arrest diversion initiative called Hope Not Handcuffs to the community. This initiative, which started in Michigan, is a self-referral, single point of access to drug treatment for people suffering from opioid use disorder and drug use generally. Hope Not Handcuffs is a collaborative effort between local police departments and community volunteers called Angels to find treatment options for those seeking assistance. Importantly, it also provides law enforcement with alternative options to either taking no action or having to make an arrest for people whose contact with the police is due to their personal drug use. From a law enforcement point of view, as long as a person meets certain criteria, they can get immediate access to drug treatment, stay out of the criminal justice system, end their drug use, and get into recovery, all while lessening the number of people filling our jails and prisons. In addition, in deflection through Hope Not Handcuffs, because people can stay in their communities to enter drug treatment and families are kept together. Hope Not Handcuffs Hudson Valley started in January of 2019 with only one police department in Orange County. In 9 months, the program has rapidly grown to 21 police departments in Orange, Rockland, Dutchess, and Putnam counties, incorporating approximately 856 police officers and a volunteer force of over 650 angels. Additionally, departments from Westchester, Albany, and Ulster counties have requested to participate in our program, but at this time, we cannot expand any further. Even though we run entirely on volunteers and unfunded staff, Hope Not Handcuffs Hudson Valley has been recognized by the Rockefeller Institute for our efforts to help fight the opioid epidemic. We are now working with the University of Albany School of Public Health to develop research on the efficacy of pre-arrest diversion programs in New York State. The program is very simple to get started in a community. Any person seeking assistance for their opioid use can just walk into a participating police department and ask for help. The person is met with compassion and respect. A community angel volunteer is dispatched to the location and immediately works to find a treatment option. To date, our program has been 100% successful in placing over 57 participants into treatment, and momentum is building. The program's success is built on trust. We all know someone that has been affected by the crisis. Participants are usually unwilling to approach the police to ask for help, but angels, as ambassadors, bring a more community element in which participants are willing to seek assistance. Angels have helped to spread the word about the program, which has caused the program to grow. It is a community solution to reducing overdose and overdose deaths. My request of you today is to fully fund Hope Not Handcuffs Hudson Valley so we can complete our work and carry it to the rest of the state. In this request before you today, we are bringing to you a solution that saves lives, reduces drug use, and gets more people into treatment, and hopes to help our communities turn the corner. Thank you so much.
Thank you. Thank you very much. I have a quick question for both of you. You both, you spoke of you're at capacity, you can't expand. You spoke to the need for more funding. In a nutshell, what will more funding allow you to do? How will it enable you to expand? And do you have any back-end data that shows in the long term we are saving lives?
I think in my case, being a completely volunteer organization, we definitely need, we have angel coordinators in our different counties, 2 angel coordinators and 4 angel coordinators in Orange County. So angel coordinators, a law enforcement liaison, a paid program director, administrative staff. So I don't think it would be a huge staff.
So it's more on the administrative side.
Correct. It's just, it's become very labor intensive for a small group. Just to measure the efficacy of the exact identical program, which is out in Michigan, it started in 2017 by a circuit court judge, and they quickly within 2 years grew to 79 police departments. They received a large state grant, and they are now statewide in every state police, municipal, and sheriff's department. And they've placed over 3,300 people into treatment in less than 2 years. So it is incredibly successful or effective, I guess you'd want to say. And this is the exact program. So I have seen it do something similar already in 9 months. So
I can speak from so Annette's Hope Not Handcuffs is one example. For example, Schenectady Cares is another Perry model who that launched in July of 23rd this year. Their model is a little more police taking initiative. They were successfully able to create a position for one of the two officers to actually lead this effort to be able to divert the substance users, but actual treatment linkage, identification linkage has been done by harm reduction service providers, Project SafePoint. And they're already stretched thin in terms of their capacity to provide services that they have to provide to substance users. They run steering injection program, they do health hub model, and they are also assistant Albanese program. And they've been telling me that they're just stretched thin. They need more personnel to assist those type of program, assist the police departments to do so. And like prior panel discussion, the salary for recovery coach or staff member at those harm reduction service organizations are pretty low. So their turnover rates very fast. So they have a difficulty keeping the staff that they need. So those are the issues that I have heard.
Thank you. Members? Senator?
And I have to tell you, I love the program, Hope Not Handcuffs, Dutchess County. I know our law enforcement is so passionate about it. But are you finding a challenge with, because I hear from parents all the time, for recovery, for places for people to go? Is that when you say they're able to help them, where do they move them to? Because I know we have a shortage of beds in Dutchess, and I'm sure actually throughout the state it's an issue.
yeah, so we do have a list of facilities that we use, a long list of facilities. We typically use the same 3 facilities.
Yeah.
It seems like a lot of times we shy away from using hospitals because of the criteria there. But I think that yes, and yes. I think that there needs to definitely be more facilities, more places to send people. I want to echo what other people have said about recovery homes and recovery living, because we can get them there, and essentially that's what we're doing. We're getting them there, but they need to be met with recovery coaches, recovery support, recovery centers, recovery housing. I mean, how do you keep them sober?
When Ashley was speaking before about insurance coverage, my brother was in Fort Winds and finally getting help for mental health issues, but then insurance cut him off. And so I think, when we talk about a time frame too for people to be in a recovery situation, we're not affording them enough time, and that's the problem. And
You're
I think,
100%
right?
correct.
Yeah. So thank you.
100%.
Thank you both very much for your hard work on this. I appreciate it.
Senator Metzger?
I just want to make a comment. I have been amazed at the level of volunteerism in this program. I mean, it's truly extraordinary. Annette has been administering it voluntarily, but the hundreds and hundreds of angel volunteers that are giving up their time to do this, and it really, there's a kind of a community coming together around this program that it has these additional benefits, right? Because it's addressing the stigma. It's getting the word out throughout the community. And I think whenever we're looking at these programs, we have to think of all of the benefits, including those sort of secondary benefits that we may not recognize. So, thank you.
Thank you.
Thank you.
I could just add to that as well, to say that this is an opportunity right now to talk about how the work that Hope Not Handcuffs is doing is how really anybody can participate in solving this problem. That, correct me if I'm wrong, your volunteers don't have clinical training until they come and meet with you and have some training, right? These are people with no experience, really.
That's correct.
Yeah.
I will say, though, that, we always say over and over, our volunteers are essentially providing compassion, support. They're a neighbor, they're a friend. They're making a phone call or two or three until we find a place for them to go. But that's huge. And probably 75% of our volunteers are actually CASACs and social workers and dentists and teachers and physicians that are just willing to give of their time because they've been directly affected. They have skin in the game like no other and passion like no other. So it really has been an incredible demonstration of human, compassion and kindness. I also want to just compliment the law enforcement that we work with, because all of the law enforcement agencies that we work with have approached us. We have not approached one law enforcement agency. I have 2 phone calls yesterday from 2 police departments near Albany, but that speaks volumes to their level of understanding that they don't want to just keep arresting these people. They realize that the criminal justice system is not the place for someone to go into recovery and sustain that recovery. So that I just want to compliment law enforcement as well.
Thank you. Anyone else?
Just one question. First comment saying thank you for doing all the work you do with Hope Not Handcuffs here in Putnam County, because I really just learned about you relatively new this year and working with Sheriff Langley in our sheriff's office. But I represent Westchester too, and I noticed that you said that Westchester has already reached out to you, but I guess you're at capacity, as the senator said, and not able to reach out to them yet. They're a massive county. Do you have the ability to work with law enforcement on a local municipal level rather than county-wide?
Oh, yeah.
And what would it, do you have an idea of what it would take from the state to make that happen?
I think, yes, we started with just one police department. Like I said, in January, we were going sort of one police department at a time when they would be approaching us. And now we've recognized that when one approaches, we say, would you have 1 or 2 other departments in your area that maybe you could, come on board with? That's what Putnam did. So okay. Putnam launches all 3 police departments together. But to answer your question, we did our training actually right in this room a couple of months ago. I think, I'm not even sure if I know exactly what it would take to do that. I mean, it's not hard to get the volunteers. I think it's just administratively, it's very challenging. But fortunately, we can look to Michigan's program to see exactly where our road is. And we stay very, very close in touch with them as to what it's going to take for us to get to that place. I'm not sure if I answered that question correctly or not.
No,
but
you did, just candidly and honestly, and I want to thank you, and I know you have a lot of other angels in the audience, so I want to thank them as well.
You know what we can do? We can, since we're about to go into budget, let's meet offline. And if you have a specific request on expanding into Westchester, we can discuss what that might look like.
we have been working with a technical assistance organization out in Chicago called TASK, and they've been preparing us with some budget type things and build outs and some we in my one pager I think it goes a little bit more into detail some of the things we would actually like to do to make this program more comprehensive. So I'm happy to do that. Thank you.
Thank you. Any final word?
Well, from
Sorry.
no, it's great that you're getting what you need, and
We're
you're
excited to be working with
yes. So in terms of effectiveness, this whole area is probably someone will ask in the end. This whole area is pretty new, and there's not much empirical evidence, unfortunately. But there are a lot of other countries, for example, Portugal, who decriminalized the drug use entirely. And there's no evidence that leads to the increase in drug use at population level. It will be helpful. Actually, it's been helpful to reduce problematic drug use, reduce harmful impact of substances in the community. People are likely to seek treatment before it gets really bad. And so there are definitely positive side to decriminalizing drug use and promote treatment, yes. So
Terrific.
this will be very important.
All right, thank you both.
Can I just say one last thing, too, for
Yeah.
anyone that, I don't know why I feel like I need to get in this, that is skeptical of a volunteer organization of this kind. I think that you have to look no further than the New York State fire departments are often volunteer, and ambulance corps, and look what they do, right? So they're volunteer run.
Thank you. Thank you both very much. All right, moving